Hello everyone, I am Dr. Srikant Venkatakrishnan, consultant and head of the Department of Physical Medicine and Rehabilitation. It is a department that takes care of patients with complex disabilities that lead to pain, loss of mobility and function, and loss of independence to the patients afflicted with various illnesses, which can be neurological, cardiovascular, or pulmonary disorders, among a few diseases that we treat. Traumatic brain injury is a very violent cause of prolonged illness. With the advent of greater development, infrastructure, faster road transport, the likelihood of sustaining brain injury through accidents or falls is increased when there are lapses in road safety or workplace precautions. Needless to say, the person suffering from this illness and their families go through a very difficult time in the aftermath of the event, and they need good quality health care to help ease their suffering. The initial stages of traumatic brain injury treatment requires careful assessment and screening for multiple injuries, monitoring, neurosurgical intervention and ICU care if needed. Thereafter, persons with traumatic brain injury go through various stages in their road to recovery. In the initial phases, they might experience impaired consciousness, associated medical problems such as lung infections, urinary infections, deep vein thrombosis, autonomic dysfunction, to name a few. They might need care of medical tubes such as a tracheostomy tube, nasogastric tube or a PEG tube, urinary catheter, and these tubes may be essential for their medical stability. And gradually, one can monitor clinical parameters to assess for their safe removal. As they continue to recover, they will experience graded changes in levels of consciousness and mobility with associated problems in muscle tightness, movement control, pain, swallowing and communication dysfunction, and cognitive problems that might interfere in their ability to perform their day-to-day tasks independently. Patients with traumatic brain injury need a multidisciplinary team led by a physician, which could be a rehabilitation physician or a physiatrist, their surgeon, their neurologist, or a doctor who is trained in rehabilitation. Important members of the team include physical therapists, occupational therapists, speech and swallow therapists, rehabilitation nurses, psychologists, social workers, orthotists or splint experts, recreational therapists, yoga instructors, and other members such as rehabilitation engineers who might individually enhance the scope and value of the rehabilitation team. It is important that this team works in a coordinated fashion so that functional goals are met. The program needs to keep changing the nature of treatments as per the changing clinical picture of the patient. A good brain injury rehabilitation program needs to be executed by a multidisciplinary team that is physician-led and has a scope of service from the ICU to the community. A good brain injury program needs to try to incorporate recent advances and treatments in a cost-effective way. It must also be able to follow up a patient after their discharge from the center till their reintegration to the community and ease the burden on caregivers and the patient throughout the process of rehabilitation. It is ideal if the program is able to facilitate access to support services and vocational rehabilitation to offer comprehensive care to the patients and their families. To summarize, when caring for somebody with traumatic brain injury or when you have to make decisions on how to deliver care, it is important that the patient is taken to a place where there is a physician-led multidisciplinary team that offers comprehensive rehabilitation services to the patients and their families right from the ICU to the community.